What is up, you guys? My name is Austin Marks. Welcome back to my YouTube channel. So I'm currently a respiratory therapist. I've been a respiratory therapist for about 2 years now. And on my YouTube channel, I talk about respiratory therapy, I talk about respiratory therapy school, I talk about PA school a little bit, and I also talk about personal finance. So if you want to see any of that, make sure you like and subscribe. So in today's video, I'm going to be giving you a few reasons as to why you should become a respiratory therapist. So many people, when they're thinking about healthcare or going into the healthcare field, all they really think about is doctors and nurses, doctors and nurses. But there are so many more careers out there than just doctors and nurses. So respiratory therapy is one of them. So when I was originally going into the healthcare field, I thought about nursing as well. But then once I started meeting with different advisors, my options opened and I landed on respiratory therapy. So my number one reason to go into respiratory therapy is you are an expert in the respiratory system. So with nursing, when you go to school, you're kind of have a broad aspect of everything. So yes, you know about the respiratory system, you know about the neural system, the cardiovascular system, and all that other good stuff. However, you're not exactly an expert at it. So a lot of these nurses, they go to school and they know about it. However, they do not have as deep as an understanding as a respiratory therapist does. So I know all about the lungs, I know all about the heart. I studied that for almost 2 years. Many times when nurses have a respiratory issue, we're the first ones they call because they have no idea what's going on, or they have a slight idea. However, they know that the experts can go ahead and fix the problem ASAP. My second tip to go into respiratory therapy is that you're changing lives daily. You're saving lives. You're going ahead and making people's lives easier, because we all know that breathing is essential to life. So therefore, what we do is very essential to all of our patients. So that's another reason you should go into respiratory therapy, is because you're helping change lives. You're serving others. The third reason that you should go into respiratory therapy is because you only have to go to school for 2 years, and the salary is actually pretty decent. So a lot of people, they'll go to school for 4 years and they're not even making what you're making. So therefore, if you look at my first two tips, you're an expert in the respiratory system, you're changing people's lives, you're saving people's lives, and my third one is you don't even have to go to school that long and you're getting paid decent. And then that brings us to reason number 4, and that's that you're always critically thinking, you're always using your skills, you're actually using your brain, you're making ventilator adjustments, you're changing medications and therapies depending on what the patients actually need. So myself, I work in a trauma center, so therefore I need to think on my feet when a trauma comes in. So if someone comes in with a gunshot wound, or maybe a stabbing to the neck or the face, I need to move, otherwise the patient may die on me. You could also even look at this past year. There was a worldwide pandemic, and it had to do with the respiratory system. So guess who was very well involved? The respiratory therapist. So therefore, you're always educating yourself. You're always learning new things, new medications, new disease processes. That's one thing that I love about being a respiratory therapist, is I'm always learning. So therefore, many times I'm actually getting paid to use my brain. And that brings me to reason number 5, is you're not doing manual labor. So I worked a job where I was doing manual labor for 10 hours a day, and let me tell you, it just killed my body. So this has to do a lot with nurses as well. Sometimes they're constantly moving patients, constantly rolling patients over, and sometimes their backs are just killing them, their feet are just killing them. With me, yes, my feet do hurt sometimes, my knees do hurt sometimes. However, it's not all the time. It could be a lot worse. Like I said, you get paid to use your brain and not do manual labor. So to me, that's a no-brainer as to why I would want to go into respiratory therapy compared to some of these other jobs. I also have a video talking about why you should not go into respiratory therapy or healthcare in general. So I highly suggest you guys check out that video. I'll leave a link in the description below. Well, anyway, if you enjoyed this video, make sure you like and subscribe, and I'll see you in the next one.